Thank you. Thank you for inviting me here today to speak. As Bella has just said, I'm going to talk about how we involve young people in medicines R&D. So I'm just going to briefly give you an MCRM vision of how we want to involve young people in our network's activities, and why is it important to involve young people, the role of the group that we've currently established, and what the group been doing since we established in 2006. So our MCRM vision is for real collaboration with young people, parents and carers at every feasible stage of the research process. I say feasible because it's not an easy task to work with young people in all stages of research design. This photograph was taken about 2 years ago of our National Young Persons Advisory Group. We currently have 90 young people aged from 8 to 18 years old, with a range of conditions, chronic conditions, a range of experiences of clinical trial participation. Some have just been in hospital, but predominantly all are consumers of healthcare. We established the group in 2006 in Liverpool. We started off with about 7 or 8 young people. We didn't really know, or I didn't really know what I was supposed to be doing with these young people. But basically we wanted to provide a platform to give young people the opportunity to learn about research. This slide's quite busy, but it was one of our young people who actually designed this slide at a recent conference that we had. And basically the bottom line is, to make research in young people for young people, you should involve young people and listen to what they have to say. And they basically raised a few issues. So obviously they raised, adults often forget that children get bored and don't want to read a 7-page black and white leaflet. But actually what that should have said was the most information that the young people actually see is predominantly 17 to 20 pages long to make an informed consent or assent decisions to take part in a research study, which is obviously not appropriate. And young people can be put off participating or left feeling confused and scared if the information isn't understandable. Now, this is from a child who took part in research when she was 8 years old. And if it wasn't for her mum and dad were actually doctors who then explained the process even further to her, but she was faced with a 20-page information sheet to actually make a decision, even if it was only informed assent. She basically said that adults shouldn't assume they know what young people want. We think differently. Some adults overlook how much vocabulary children understand, making leaflets too complicated or patronising. Young people's experiences and research must be listened to in order for research to improve. And they know what they want, and they know what they don't want, and no information overloads. So, predominantly the role of the group, and I've put learning up there because of this conference, it was to provide a platform to teach our young people about different types of research. So it wasn't just clinical trials, it was any qualitative research, observational studies, any type of research, just to give young people a platform to discuss these issues so that they could fully participate, contribute, and discuss and disseminate research findings of relevance to other young people. So what have the group been doing? The group have been doing quite a lot. I mean, when we first set up, it was predominantly looking at patient information leaflets and getting it signed off so that it could go through to ethics. But actually, over the years, we've developed our role, and they've been working on quite a lot of projects. We have worked on approximately 50 studies, and that includes industry-sponsored studies, in the design of patient information leaflets, but also looking at outcome measures, the practicalities of the studies, and obviously working with researchers in their grant applications, so a very early stage of research design. They've took part in consultation exercises around ethical debates around consent, assent, risk versus benefits of taking part in research. We've also worked with the National Research Ethics Service in the UK to actually revise their current guidance document on patient information leaflets, which is 196 pages long for researchers to actually read. And our young people, there's very, it's unclear on what is actually meant by consent and assent, and our young people want to make that clear within that guidance document. We are currently planning a major conference in September in the UK, held at the London Science Museum, with children and families to basically showcase all the excellent work that they've been doing to shape research into medicines for children in the UK. And this is just the last slide to say that obviously the young people are there to help with researchers, and that to work in partnership with young people is crucial. And I've listened to some presentations this morning about better informed patients, and I think that's what we're trying to do with our young people and families in the UK. Thank you.
Thank you so much, Jenny. I can say from personal experience of working in the UK that, you know, this approach is being really influential in UK and NIHR circles. Any questions for Jenny before I hand over to Jan? Please, Soren.
Thank you for a great presentation. My brief question is, so how do you work with the industry, or how could the industry be benefiting from this fantastic experience? Because I think oftentimes there are difficulties in this transfer of knowledge, so it would be really helpful to understand how these things are being embedded into the way the industry is running the clinical trials.
It's actually taken quite a few years to actually get that partnership built, but I think as the MCRM have got an industry team who advocate that they should be coming to the young persons group at a very early stage. So over the last 6 months, we've witnessed about 8 pharmaceutical companies coming to us to actually say, can we get support from your young persons group in various capacities, so whether it's patient information leaflets or the practicalities of the study. And what we're doing is trying to get the pharmaceutical companies to come to the meetings of the young persons group, and it has happened. So we've actually got industry coming to one of our meetings tomorrow. So, and that is over the last 6 months, and I think that's because of the team are actually saying, you know, this is a resource for you, and actually work in partnership with our young people. So we are witnessing an increase in that.
Okay, thank you. Oh, one last question at the back then.
Thanks again for a great presentation. I have a question, and I was struck by the point you made that kids get bored, or young people get bored when they look at information sheets. And do you ever get approached by adult groups to learn from you about your experience? Because I think many adults also get bored.
Yeah, the project that we're working on with the National Research Ethics Service is everything that we've said, and we work with adult organisations as well, and parents. Parents are actually faced with even more information, and they're saying, well, actually, I'd rather read the child information first if it's done properly. So it's that. So we do work with adults, and we're trying to get that into the guidance document. We're trying to fix that because parents don't want to read 20 pages long, you know, and there is that issue of informed consent.
Thank you very much. Thanks, Jenny.